Okay, now that we've shared the videos from the patient experience, the visitor, and the nurse experience, we wanted to share our own personal point of views on technology in healthcare. And as a nurse, I've always been interested in using technology to improve the patient care experience as well as the clinical outflows. And as a leader, I look to find solutions that are going to meet those objectives. Luckily enough, I was on the West Campus and I was able to participate in the selection and design and implementation of new technology. Knowledge is power, and everything that technology is involved with is critical. So it's certainly emphasized how vital technology is to the healthcare setting.
I have 4 little statements on my point of view. As a nurse, as an advanced practice provider, and now as an information services leader, I see the value of technology as a thread of ensuring continuity of care for our patients and clinicians. I traded in my stethoscope and otoscope several years ago to provide care via technology. It is important that technology enables clinical workflows and does not hamper our patient care and the safe environment that we provide. The continued advances in healthcare technology, as we see in this room and what you saw in the vignettes, provides ample opportunities for data mining and research. And changes made to nursing, provider, as well as our ancillary services care should consistently be made by reviewing an evidence base, whether it's at your own institution, we're gathering that data locally, nationally, or globally. And finally, and for those of you in the room that know my role here, you'll laugh, it's not just the EMR, it's the cumulative impact of technology on healthcare systems and what we're doing to the visitor, the patient, and the clinician.
So as you all saw in the video, and we all know because we live it every day, the proliferation of technology has forever changed healthcare. I don't think there's one person in the room that would disagree with that. It's changed the way that clinicians deliver care, and it's changed the experience that our patients and families had. And without a strategic focus, this explosion of technology really can impede the patient's experience. It can change our care processes, and it has a huge impact, as Trudy talked earlier, on our quality of care within our institutions. So one of my goals is to ensure that we utilize technology in a way that supports and optimizes care and doesn't hinder that care. I always joke that I know that as a nurse, and as a clinician at the bedside, I did not come to work, put on my scrubs and my stethoscope, and get really excited about talking about computer programs and interfaces and AO7 messages and all of those things. But in my role now, I realize that there are clinicians that chose their professions because they wanted to impact quality of care and they wanted to improve quality of life. And so within our roles and through the integration of technology, we have a very, very important job. So through the selection, implementation, and enhancement of technology, we have the ability to ensure that clinicians have the tools, the resources, and the data that they need to provide the best possible care. This enables all of us in this room, all of us who integrate technology and clinical care at the bedside, to support the clinician in doing what he or she is passionate about, which aren't the things that we're talking about today. What they really want to do is provide outstanding quality patient care. It's a big responsibility that we all have. And I know that with summits like this one and the different things that are going on in our industry, we'll figure out how to do that in a bigger and better way. So this morning in our session, we've really provided you some multiple perspectives from the bedside, from the nurse, from the patient, and from the visitor regarding how technology impacts care. You've also heard our point of views from 3 nurses in divergent roles across the organization. But we'd really like to continue that dialogue as we did in the previous session, and we'd like to hear your perspectives. What are your thoughts? What are you doing in your areas, in your organizations? As well as we're open certainly to taking questions from you about what we're doing here at Texas Children's.